What political battles impacted ACA state health exchanges? The Affordable Care Act, often called the ACA, brought significant changes to health insurance in the United States. One of its key features was the creation of state health exchanges. However, the journey to establish these exchanges was marked by political battles that shaped their development. Partisan divisions played a major role in how states approached the ACA. Many Republican-led states resisted creating their own health insurance exchanges. Instead, they often chose to rely on the federal exchange or even blocked the creation of state exchanges altogether. This opposition stemmed from a broader Republican resistance to the ACA itself. Interestingly, some Republicans had previously supported the idea of insurance marketplaces before the ACA was enacted. On the flip side, Democratic-led states typically embraced the ACA and actively worked to set up their own exchanges. This created a patchwork of exchange models across the country, leading to differences in access and coverage based on where people lived. Another significant factor was the tension between state and federal control. The ACA allowed states the option to create their own exchanges or default to the federal exchange. This federalist approach led to debates over states' rights. Some states were wary of federal involvement, citing concerns about overreach. Others welcomed federal support and chose to build their own exchanges to meet local needs. This tug-of-war over power between state and federal governments became a central issue in the political landscape surrounding health exchanges. Interstate conflicts also influenced the establishment of exchanges. Even in states where governors supported the ACA, state legislatures sometimes blocked the creation or funding of exchanges. A notable example is Michigan, where a Republican governor backed the ACA, but the Republican-controlled state Senate prevented the establishment of a partnership exchange by refusing to allow state agencies to use federal grants. This highlights how internal political dynamics can stall or shape the implementation of health exchanges. The issue of Medicaid expansion was another battleground that impacted state health insurance markets. The Supreme Court ruled that Medicaid expansion under the ACA was optional for states. This led to ongoing political debates in many states about whether to accept federal funds to expand coverage. States that opted out of Medicaid expansion often also resisted creating health exchanges, which compounded coverage gaps for residents. Political leadership changes at the state level also had a significant impact on exchange decisions. Governors and state legislatures influenced whether states would support or oppose the ACA. In politically divided states, governors facing re-election sometimes sought bipartisan cooperation to support exchanges. However, others aligned with their party's opposition to the ACA. Election outcomes could lead to reversals or modifications of exchange policies, affecting the stability and future of state exchanges. Finally, the broader political context surrounding health policy debates played a role in shaping the ACA exchanges. Issues of affordability, coverage, and the role of government in health insurance were highly politicized. Health care often emerged as a key issue in political campaigns, and political stalemates at the federal level increased the importance of state actions. As a result, state exchanges became focal points for implementing or resisting ACA reforms. In summary, the political battles surrounding ACA state health exchanges were driven by partisan opposition, disputes over federal versus state authority, internal conflicts within state governments, and the interplay with Medicaid expansion politics. These dynamics influenced whether and how states established exchanges, ultimately affecting the availability and design of health insurance options for millions of Americans. Understanding these political factors is crucial, as they directly shape the regulatory environment and consumer access to coverage through ACA marketplaces.